Hi, I'm Alinsod. I'm a urogynecologist here in Laguna Beach, California. I'm here to present to you carboxytherapy. I'd like to give credit to Dr. Gustavo Libashov and his partners who did the studies that they're allowing me to share with you. I'm a urogynecologist again, and so are these doctors here, Dr. Gonzalez and his partners in Colombia. I'm here in Laguna Beach, and I take care of women's health, and take care of urogynecologic conditions, menopausal issues. For my disclosure, I'm a developer for some of the pelvic floor physical therapy devices and Thermiva and Lone Star retractors and things like that. So I'm a consultant for some of these companies here, including Lumisque, Amnion, and Integen. Today, what we're going to try to do is we're going to try to cover what is GSM, what is carboxytherapy, what are the research behind it, and also to tell you what we can do with it and some of the clinical stuff that we can do for gynecology. So these are the things that we're going to cover. First of all, what is GSM? GSM is genitourinary syndrome of menopause. And what is that? In 2014, it was defined as a collection of symptoms and signs associated with a decrease in estrogen and other sex steroids involving changes to the labia majora, minora, clitoris, vestibule, introitus, vagina, urethra, and bladder. Basically, aging down here in the feminine regions that result in these problems that we're going to talk about. Some of the problems are caused by menopause, caused by removal of the ovaries, taking anti-estrogenic drugs such as tamoxifen, drugs that are used in breast cancer treatments, chemotherapy, pelvic irradiation, having a baby postpartum messes up the hormones and people get very dry down there. People with severe weight loss and anorexia also have these problems. And also unknown issues, unknown causes. And these are the complaints women talk about and complain about when they have GSM. Burning with urination, bloody urine, leakage with coughing, sneezing, and jumping. Also, urinary urgency and frequency, repetitive urine infections, genital complaints, dryness, atrophy, burning, itching, painful sex, tearing of the skin, bleeding with sex, and vaginal discharge and recurrent infections. Those are the common problems that happen because of the lack of estrogen and GSM. So, what we're going to talk about today is what are the effects of carbon dioxide in genital tissues. In general, carbon dioxide therapy, injectable carbon dioxide with fine needles, has been used for over 25 years in South America and Europe, and now it's entering in the United States in some areas, though it's not approved yet in the United States as an injection, but it is approved as a gel that is now available. So, what does carbon dioxide do? It increases the tissue oxygen content. It increases the flow and dilation of vessels. It increases the extracellular matrix and cleans it up, and it gives relief to many women with these problems that they have in their genital regions. What is the future of carboxytherapy? Well, if you look here, a before treatment and an after treatment results in an increase in these vessels. They're called vertical capillaries, and when you increase the vessels in these tissues, there's increase in blood flow and healing of tissues and more oxygen in these areas. So this was developed in Japan, and it was produced by Dr. Sakai and his team at Kobe University. It's been out for a while now, and it's now in the United States. So these are the things that it's been doing in Japan and now in the US. Medical grade treatment for wounds, for healing, for burns. Oxygen is increased in the skin. Carbon dioxide causes dilation of the vessels. The vessels think it's starving of oxygen, so now the vessels expand to increase the oxygen. And it improves the metabolism of cells, increases the blood flow motion, and it's also anti-inflammatory. So this is excellent for face and other areas, and now in the genital regions. So here's the device. This is called CO2Lift V. There's a large packet and a small packet, and when you mix it, there is production of carbon dioxide. You mix it in a little container, and this is what basically happens right here. Let's see if this will play for you. Here's the gel that's pre-mixed. You place it in the vagina very quickly, and then the leftover gel that's in your container, you take it, you put it in your fingers, and then you wipe it on the external genitalia. This will improve the blood flow in the external and internal genitalia. 45 minutes later, you can wash this out with just regular water, and it will start the healing process. All right, so here it is. It's for prevention of the ravages of aging, to increase the moisture. When you can't take hormones and you're not allowed to take hormones, let's say like breast cancer, it's a great treatment for the dryness. For those who've had radiofrequency or laser treatments or surgery, it can help with the healing also. It can maintain your tissues in a healthy state. No needles, no risk of infection, no pain, no downtime, and you place it yourself. Here's a before. You can see how red and irritated an area here is inside the vagina. Here it's very, very dry, so it takes care of both the dryness and the irritation. And after about 10 treatments every day with the cream, you can see that the color changes, the pH inside changes, the moisture increases, the tissues become more and more elastic, and the patient's able to have comfortable intercourse. Here is a picture of an area that was treated. She was biopsied, and then here are the results of the biopsies. Here, before treatment, you can see how thin the skin is and how highly irritated this area can be, consistent with syndromes such as lichen sclerosis. It can be used for the thinning of skin. These patients with lichen sclerosis can have itching, irritation, and burning, similar to menopausal symptoms. After you treat it, this lady was biopsied again 21 days later, and you can see here the thickening of this thin tissue. There's an increase in glycogen. The tissues are more mature, there's more metabolic activity, more oxygen is being brought to the tissues, and you can see here on a different kind of stain, there's an increase in glycogen and collagen. You can see how these areas all improve. All the bluish areas, this is called a Mason stain, and there's an improvement in tissues. Here's another picture for you to show you what happens if you treat with estrogens. There's from a thin layer to a thicker layer. Sorry, it's black and white. If you treat with CO2 lasers, you can go from a thin skin to a more thicker skin with deeper rugations. This one is with radiofrequency, and you can see the similar results, thin skin to more rugated, thicker skin. And now here's one of radiofrequency treatment, and what I'm trying to point out is that the results seem to be similar to radiofrequency and laser treatments. The skin gets thicker, and this is a much cheaper treatment. It's gel only, showing significant improvements in peri and menopausal patients, especially in the symptoms of dryness, pain, during sex, painful intercourse. With the burning and itching, it can help these problems. A study is called FSFI was used for these type of patients. And in these parameters, in lubrication, desire, excitement, orgasm, and dyspareunia, it showed an improvement in these type of symptoms. So we believe that this can help your peri and postmenopausal patient improve their sexual life. Here's some visuals of a before and an after, some of the macroscopic changes that you can see. Only 2 days later, you can see some of the skin starting to get a little bit tighter. Here's one that's 5 days later. The skin gets a little bit tighter. You can see improvement internally in moisture. The patients will tell you that their moisture has improved. And after the treatment, an average treatment is 5 days straight, up to 10 days straight, the patient finds significant improvement. So there's a group of patients with GSM that don't want hormones, don't want surgery, don't want lasers, radiofrequency, and they want a good treatment. So what can you do for them? You can try CO2Lift V. Such patients would benefit from this carboxy therapy because it's non-invasive and it's quite safe. It's non-surgical. There's minimal risk to this procedure. So these patients, again, give it a try. Patients with radiofrequency treatments or laser treatments can also benefit from pre-treatment and post-treatment maintenance. Combination therapies can give you good results. It can be used as a standalone product, and it can also be used as an adjunct to laser or radiofrequency therapies. It's affordable, and it can be sold in the office so the doctor can benefit from purchase by patients. What else can happen? I think this can be an adjunct to any primary care practice, gynecology practice, urology practice, urogyne practice that deal with women. You don't have to be a cosmetic gynecologist to help women in this field.